And this is the community clinic that we work with as well within the community itself. So this is the health clinic under the Ministry of Health. So it's improving services for adolescents in the community clinic. And so where they identify high-risk teens, this is a focal point of support for teen sexual and reproductive health services. They do have efficient referrals as well. The whole study, it's of course based on this logic model. Is actually just a visual illustration of the program resources, the activities, our output and the outcome, and the impact of all the activities that we have carried out. And so this logic model is basically a tool used to simplify complex relationship between all these various components. And it can be used, during any program planning, implementation, and evaluation. The term that we use, synonymously with logic model is the theory of change. It's a foundational concept that provides an understanding of the pathway to bring about change. So in the field of public health and health promotion, this whole logic model continues to be viewed as a valuable tool. It illustrates the relationship between our input into the program and the activities and the desired outcome. For instance, it is based on assumptions as well. For instance, since this is gender-based violence, there are many different types of, our assumption would be that there are many different types of gender-based violence in terms of physical, sexual, emotional. And youths are vulnerable, for all these violences. And there's a risk of violence, at the individual, relationship, community, and society level. Our input into this whole logic model, into this whole program, will be the input of the academic, the experts, the NGO, the community leaders, where we work together with the youth leaders, volunteer, of course, money is involved, finance is involved, and the other relevant agency. And when it comes to activities, we have training programs, we set up protocols, basically the health care service provider. And as for the youth that we are targeting, we have empowerment workshops for them. We carry out all these activities, via posters, via emails, Facebooks, and other, social media. And for the community as a whole, so we have collaborative efforts, particularly working very closely with the community leaders, public awareness, basically giving them public education. And of course, at the end of the day, we have all these evaluation activities as well. And so our activities focuses on healthcare service provider. That means educating our healthcare providers to be sensitive and to be non-judgmental in dealing with sexual and reproductive health or gender-based violence related to all these teens. And we have programs related to youth. So our next target is on the youth and the community, the population as a whole. And our output, how do we measure, with all these activities, it's like we would like to see, in fact, we have seen an increased number of sensitized healthcare providers, increased confidence to provide immediate response, and increased local capacity. And as far as the youth are concerned or the adolescents concerned, they are better informed of the resources, reduce isolation where they come together in this workshop in all our activities, and therefore they build the network among themselves. And also there's an ongoing support among the youth. And our outcomes, we have both short-term outcomes and middle-term outcomes. Outcomes in terms of learning, creating awareness, knowledge, attitudes, skills, aspirations, and their motivations. And at the end of the day, what we hope to see is the enhancement of the safety and justice for the youth. And so this is a whole logic model that the program is actually based on. Now, as far as the methodology is concerned, the Ministry of Malaya, my colleagues actually initiated this 2-year knowledge transfer program starting in year 2014, and for a community located in an urban poor area in Kuala Lumpur, Klang Valley. And we support and empower survivors of gender-based violence and its training experiences, and including co-development of a gender-based violence curriculum for National Youth Training Program in Malaysia. And all these are vital to the knowledge transfer program. And we do have workshops on needs assessment, understanding gender-based violence, healthy relationship, sexual reproductive behavior, building self-esteem, and communications and leadership skills for the youth. So this systematic building up of the youth knowledge. What we have here, the results is our baseline data. This is prior to the intervention. Youth lack self-esteem, knowledge of what constitutes risky sexual behavior, and really how to say no to unhealthy relationship. And after training, we have actually run about 4 empowerment workshops for the youth. The post-training evaluation indicate a mini transformation of at least 20% of the 50 youth participants. They share their testimonies, show that they experience changes in their attitudes and behavior. And the boys spoke of productive use of time, and the girls informed of their ability to speak up for their rights. What is interesting to note is the setting up of a youth club, and through a very democratic election of a boy and a girl to co-lead the club indicated development of youth identity and their leadership skills. And so what we see here, it's the horizontal, the inclusiveness, and the participatory methodology used to capture youth interest throughout this whole sessions. And, the whole idea, the concept of experiential learning through games, role plays, drawings to illustrate health issues such as sexual and reproductive health, violence in the community, knowledge in communications and leadership. And they prefer to, talking down to the youth. And such methodology create a safe environment, building a rapport and trust. And with this, it enables the youth to share their concerns and challenges, which facilitated development of their self-esteem and health literacy skills. The continuity of the activities in this youth club showcase the learning capacity of youth in knowledge, attitudes, and their skills as well.